everybody, and welcome to the Sharp podcast. Today we are talking with Apostolos Bossios. He is an associate professor of respiratory medicine, a translational researcher in pulmonology, and a respiratory physician with specialty in severe asthma at the Karolinska University Hospital in Stockholm, Sweden. My name is Fabian Jaun, and I'm the national coordinator of the Swiss Severe Asthma Registry. So, Apostolos, how did Sharp help to answer research questions that are important for clinical practice?
We are in Sharp because we care about our patient. And severe asthma is a disease of many phases. It is common, but not such common. So we need to put together all our strength and experience to do the best for our patient. In this way, Sharp make the big difference because when I share my knowledge and my question and my experience with other people that they have the same questions, the same problems, or they have another issue, another question that I have not thought. So talking with them and exchange experience and questions, it makes all the difference for our patient. So from seeing 20, 30 patients, now I have the experience of 700 patients altogether. And this is unique. And I must say that there are several severe asthma cohorts or associations in the whole world. Sharp is the only one that we have patient in focus. And that makes the big difference. Because not only with fellow clinicians, we have scientists, and importantly, we have patients. So we also get questioned what the patient thinks is important. An example of that is usually when we meet a patient, we just ask, check the test, the lung function, and then many of patients say, well, it doesn't matter for me if my X test, for example, eosinophils, they are 10 or 20 or 25. My problem is that I'm very tired and I cannot live a normal life with my family or doing my work or I'm exhausted. Things that we haven't thought before. And this is unique combination, patient, clinicians, scientists, and pharma representatives. So to make a long story short, Sharp has made me a better physician for my patient.
It opens the view as well how we look at severe asthma. We don't have only the scientific side and the physician side, but the important view of the patients. This leads me to my next question. Do you think that all stakeholders and especially scientists have the same standing in this collaboration, or are there differences? How is your experience about the standing of scientists in this collaboration?
Myself, I'm a translational scientist, so I am interested in cells and the mechanism. They are underlying the inflammation and linked to the symptoms. And in that part, scientists is very important because when a patient comes and say, I'm very tired, for example, myself as clinician, I try to link the symptoms and different pathophysiology, cells or inflammation. And then comes the question, why? And this is the question that science can answer. And then, for example, we say, okay, we do that, for example, with exacerbation. We know that there were eosinophils, an inflammatory cell. Then we find out that for eosinophils to survive, there is one protein that's called interleukin-5. We find that using cells and animal models and all that we do as scientists. And then we give the possibility to the pharma to make medicine. So the big revolution that we have now in our severe asthma patient is this biologic that actually block this protein. And this is a big journey. It's like a chain. Every link is important. If we break one, we don't get anywhere. So scientists, it's a major part. And we need that. This is that make the difference for our patient.
I really like this image of the chain we built with Sharp. Every single stakeholder in this collaboration is equally important to improve the life of patients with severe asthma. Doesn't matter if it's a scientist, a patient, a pharmaceutical industry, or a clinician. So one last question. What do you wish for Sharp in the future?
Well, I wish that all physicians in Europe but also outside Europe, that are dealing or are interested or want to learn some more about severe asthma will join. And SARP will be a big family and grow for all physicians and importantly, all patients. So every patient can come and with national societies, national organization, be actively involved and get information. So to make again a long story short, I wish for SARP to get in every severe clinic in Europe.
Thank you to you, Apostolos, to all the listeners, and wish you a good day.
Thank you.
If you'd like to hear more podcasts about the work being done by SHARP from the perspectives of different stakeholders, then visit the SHARP website at europeanlung.org/SHARP. You can also find additional information about SHARP projects and research programs, as well as how to join the SHARP CRC by visiting the website.